Lifeline Childline Namibia strives to be a child-safe organization. So basically, we are committed to providing all children in Namibia with care and protection, and we firmly believe in the right of all children to be protected from all forms of violence, abuse, neglect, and exploitation as set out in the UN Convention of the Rights of the Child. What we do at Lifeline Children is that we provide free and confidential counseling through our 116 Child Helpline and our 10 GBV Helpline. Both of these helplines are accessible 24/7 and they are both entirely toll-free. We then as well offer face-to-face counseling. We do school-based outreaches. We provide trainings to children on various topics such as OXIA, which stands for Online Child Sexual Exploitation and Abuse. And we also conduct community outreaches where we sometimes identify children in need of our services. Something else that we also do is we advocate for better child protection policies, and we work closely with partners such as Ministry of Gender Equality and Child Welfare to respond to children in crisis.
So what protocols do you follow when handling sensitive cases involving abused, neglected or vulnerable children?
Our work is guided by our standard operating procedures and our child protection policy, and as well as by the Child Care and Protection Act. So the following steps, what we normally do. Firstly, we conduct interviews with the child, family members, and other relevant parties. Once that is completed, we then assess the child's physical, emotional, and psychological well-being, and we do all of this coordinating with law enforcement and child protection agencies. In-house, we have case management and intervention, which will be done by developing a care plan that is tailored to the child's needs, and then we also provide counseling as well as support services to the child.
How do you ensure that children feel safe, heard, and supported when they reach out for help, whether by phone, in person, or through community outreach?
We mainly make sure that we train all of our counselors and outreach staff to use child-friendly communication and telephone etiquette. So whether a child calls our helplines or visits our center or meets us during school outreaches, we ensure that they are listened to without judgment, because the main goal is to create a safe and trusting environment. And we do this by establishing a welcoming and non-judgmental space where the child feels comfortable enough to share their. By incorporating active listening and validation, we then encourage the child to express their feelings and concerns without fear. We validate their emotions and we reassure them that their experiences matter. We then also have to explain their options to them clearly so that they feel empowered and safe.
So what kind of counseling or psychological support is offered to children who are going through trauma, and how is it tailored to their age or situation?
We offer age-appropriate trauma counseling as counselors. However, the social workers, they provide in-depth counseling. So every session with the social workers is adapted to the child's developmental stage and cultural context. The social workers will sometimes use play therapy with younger children, and this helps the child express their emotions through play rather than words, because some children might find it difficult to say what they're going through. Then they also sometimes use art therapy, which allows the child to process the trauma through creative expression rather than using words as well. Because sometimes the words that they will use, kids feel uncomfortable saying these words. So these are the other therapy tools that our social workers use. We then also provide ongoing emotional support, and when needed, we refer the children to psychologists or social workers for more specialized care.
Looking forward, can you please tell us what kinds of situations do children face when they reach out to Childline, and how does your team respond to them through those challenges?
Children often contact us about abuse, neglect, bullying, peer pressure, or mental health struggles like suicidal thoughts and anxiety. So our counselors assess the urgency, provide immediate emotional support, and then they work with child protection partners to intervene if the child is in danger. But for less critical issues, we offer guidance and counseling, and then check-ins and referrals are done as needed.
As we celebrate the Day of African Child, what role do you believe this day plays in creating awareness, and what activities or messages are you sharing with the children this year?
This day reminds us specifically of the importance of focusing on our children and their rights. This year specifically, it reminds us of the importance of including children in national plans and budgets, because the theme this year is Planning and Budgeting for Children's Rights, Progress since 2010. So this theme is aimed at assessing the level of progress achieved shift in mainstreaming children's issues in planning and budgeting by members of state. So it further encourages us to assess and reform mechanisms of budgeting and planning to adopt a more child rights-based approach. But here at Lifeline, we will do what we normally do on this day, and that is we let the children speak for themselves. We have a program here at Lifeline Children called Childline Radio, which is a radio program for children between the ages of 10 to 18. So for this year, our young presenters will take over the airwaves of Focus FM, so the kids will get the opportunity to co-host at the radio station from 7:30 in the morning to 5 o'clock late in the afternoon. So the kids are going to be live, they'll be having conversations with the lead hosts in the studio, and they will get an opportunity to share their views and advocate for their peers. We also have 4 Uitani radio presenters that will be joining other children at NBC for the NBC Children's News Bulletin. At Lifeline, we really emphasize the children need to be heard because the voice of a child is very important, and that is what we are trying to do on Day of the African Child. We're giving the children a space where they can speak and be heard.
Finally, what are some of the biggest challenges Lifeline faces in protecting children's rights, and how can the public, especially young people, support your efforts?
Like any other NGO, we face challenges like limited resources. The other challenge we face is social stigma around abuse. There's a lot of stigma around abuse that also impacts our work. And we also face challenges of gaps in child protection systems. Young people can help by being advocates. If there's abuse, if they witness abuse, they should report the abuse. If they're experiencing abuse, they should report the abuse. If somebody reports the abuse, they should support their friends or their peers who have reported the abuse. And just spreading awareness about services like ours will also go a long way. The public can also support by volunteering, donating, or simply promoting positive parenting and safe environments for children. Young people need to strongly believe in the saying that says it takes a village to raise a child. Basically, don't just watch your neighbor's child suffer in silence. We all have the power to intervene in some way or the other. At Lifeline Children, you can call us anonymously and report an incident or report a child that needs our services, and we will not give away that you are the one who reported it. Calling us costs nothing. All you have to do is just report it so that we can do something about it. As a community and as Namibians, we need to stand together to make the world a better place for all of our children.